You may not think of dermatologists as saving lives, but there are some serious, life-threatening conditions where they can make a difference, especially with an early diagnosis. Here to talk about why that's important for dermatologists is Dr. Paolo Romanelli of the University of Miami. Dr. Romanelli, can you tell me about your mitral valve prolapse study and what you found?
Yes. My interest in dermatology was always to identify the skin as a potential window of information to very serious systemic disease. And because of personal interest in cardiology, I had this idea that patients with severe mitral valve prolapse may die suddenly of arrhythmia, not because of the mechanic problems with the valve, but also because the disease could be a systemic disease. And instead of involving just the valve, the mitral valve in the heart could probably involve also the skin and the conduction system of the heart, and then unfortunately cause arrhythmia and sudden death. So we tried to put together a study at the University of Miami where we had 8 patients with severe mitral valve prolapse by definition from the cardiology literature, and we did skin biopsies and objectively assess the content of mucin and proteoglycans in the skin, the same ones from the mitral valve. And we also had 6 controls total. Originally we had 4, but then we added 2 more. So with the 6 controls, we found some statistically significant data showing that patients with severe mitral valve prolapse also have much increased mucin/proteoglycans in their skin. So the idea was that with a simple skin biopsy and some objective biochemical assay of the mucin, we'd be able to prevent these catastrophic sudden deaths that sometimes we read in the papers of young people playing sports. And since mitral valve prolapse is so common in the normal population, some people believe it's up to 5% of the population, is considered to be a normal variant of anatomy. But there is a small subset of patients with severe mitral valve prolapse, not the normal variant. And these are the ones we would like to recommend skin biopsy and then further evaluation, and then get some preventive measures to avoid potential sudden death.
So if a general practitioner, like a family physician or an internist, suspected they had a patient with severe prolapse, or they knew about it from imaging studies or something like that, you envision a day when they can just do a skin biopsy or send them to dermatology for this kind of assay and say yes or no in terms of, or to sort of look at their risk and quantify it somehow?
Yeah, absolutely. This is exactly the goal, and I want to say in a scientific way, the dream to save lives, to have the internist assess the mitral valve prolapse, do the echo, check if the leaflets are thicker or redundant, more than 9 millimeters, and then recommend a simple skin biopsy on the arm. This is the standard area where we did it, and other literature papers did the same. And then, according to the results, counsel the patient, or saying you should avoid strenuous effort, you cannot run the marathon. When you play basketball, do amateur but not so much competitive, and maybe even take some medications like beta blockers. And when it's very serious, we had patients with atrial fibrillation and mitral valve prolapse in our study. Even electrophysiological studies could be important to assess. I see dermatology as again, a very important specialty to collaborate with internists and not just to think of only the skin.
This is Damian McNamara with Skin and Allergy News Digital Network, reporting from the American Academy of Dermatology annual meeting in New Orleans.